Hello there, I'm Dr. Petrache, diabetologist. Today I will talk about first aid in diabetic coma caused by hyperglycemia. There are two types of emergencies if you suffer from hyperglycemia, namely diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome. Diabetic ketoacidosis is a severe condition that is typically caused by hyperglycemia. Hyperglycemia means high blood sugar. I advise you to test urine ketones if your blood sugar exceeds 240 milligrams per deciliter or 13.3 millimoles per liter. Untreated diabetic ketoacidosis can lead to coma and death. In diabetic ketoacidosis, the body uses fat for energy just like it does during fasting. When glucose is not available, the body uses fat for energy. The result is the accumulation of ketones. The body uses fat for energy when it doesn't have enough insulin to let glucose enter the cell. The main reason for the increase in the number of ketones are there is no insulin in the body, or insulin is not used properly, an acute infection or non-infectious disease, dehydration, vomiting, high fever, but also certain drugs such as steroids. Most of the time, diabetic ketoacidosis sets in gradually. However, when vomiting occurs, this condition can accelerate in a few hours. Among the initial symptoms of diabetic ketoacidosis, I mention extremely dry mouth, severe thirst, frequent urination, hyperglycemia, high levels of ketones in the urine. Symptoms that show that the condition is getting worse are dry skin, marked fatigue, abdominal pain, nausea, vomiting, shortness of breath, smelly breath, and confusion. The second type of emergency caused by hyperglycemia is called hyperosmolar hyperglycemic syndrome. Hyperosmolar hyperglycemic syndrome is a life-threatening complication in type 2 diabetes. Hyperosmolar hyperglycemic syndrome is different from diabetic ketoacidosis because it involves marked hyperglycemia without the presence of ketones. Occasionally, ketones may appear, but their level is minimal. Hyperosmolar hyperglycemic syndrome is a condition that can be caused by a separate but serious condition, such as a severe infection, myocardial infarction, or stroke, drugs that affect insulin levels, diuretics, and any other condition that involves significant loss of fluids, such as diarrhea or vomiting. Fluid loss makes the blood more concentrated. Because the blood has a high concentration of sodium, glucose, and other substances, water is eliminated from vital organs, including the brain. Here are the early symptoms of hyperosmolar hyperglycemic syndrome: severe thirst and frequent urination, dry mouth, nausea, fever, weight loss, weakness. As the condition progresses, other symptoms appear such as convulsions, confusion, inability to speak, loss of muscle control, movement problems, but also coma. Remember that these symptoms can appear gradually in a few days, even weeks. The first step in diabetic ketoacidosis and hyperosmolar hyperglycemic syndrome is simple. Call your emergency number and request an emergency medical crew. While waiting for the emergency crew, if the person is conscious, breathing normally, and does not bleed from falling, give them some space. Place them in the shade in a safe position and help them hydrate. Don't inject them with insulin if you haven't done it before and you do not know what the required dose is. Do not give them glucagon because glucagon raises blood sugar and only makes the situation worse. If the person in front of you is unconscious and not breathing, place them face up and start performing CPR. 30 chest compressions and 2 mouth-to-mouth breaths. Before resuscitation maneuvers, make sure that the person in front of you does not have blocked airways. That's about it for today. I am Dr. Petrache, and until next time, take care of your body and soul.